Your embryo transfer day is coming up, ladies. I know you're pumped that you're finally at the point where you can transfer an embryo, and I'm so excited for you because if it's a good quality embryo, there's a very high chance that it will work and that you'll be pregnant. This video goes over the embryo transfer. The procedure is basically the same for a fresh embryo transfer and a frozen embryo transfer. Luckily for you, the embryo transfer process is super easy and actually kind of fun because you get to see the little babies before they're put inside your body. I'm gonna tell you all about it. I am Corinne Smart, and welcome to Wanna Be Mama. First off, I just wanna say congrats for making it this far into your fertility journey. Like, getting to the embryo transfer phase means you've spent a lot of money and you've cried a lot of tears. So, good job for making it without breaking down. If you're new to Wanna Be Mama, be sure to subscribe to my channel and click the notification button for some awesome upcoming videos. I'll be creating videos about my pregnancy, but then also I'm going to do some extra things. I will promote that when it's ready to go. I'm still going to be talking about infertility stuff. And then if you do get pregnant, I'll be talking about mom stuff too. So stay tuned. There's some pretty fun things coming up. It takes about 2 months to prepare your body for embryo transfer. I'm not gonna go over the exact medications because each doctor might be different, but you'll most likely be taking Lupron in your stomach daily for a certain amount of time. And then I think it's around like 6 days before your embryo transfer, you'll take progesterone shots that go into your hip muscle, and you'll take those shots for up until 10 weeks gestation. And you'll probably have to take birth control too. Your doctor might have you take other things or like change up those medications. So just FYI, just know it takes 2 months to prepare your body, and then the embryo transfer happens. I've had 3 embryo transfers. If you guys follow my channel, you know that the first 2 embryo transfers failed, but the last one worked. So praise be. When you go into the clinic, they ask you to come in with a full bladder, because they put an ultrasound on your stomach instead of using an ultrasound vaginally to see your uterus. I'm gonna give you a little tip. Don't take that like super literally. So the first time I went in for an embryo transfer, I chugged water and I made sure my bladder was very full. I had a legit full bladder, so full that I almost peed all over the doctor's face. My suggestion for you is pee before you leave the house. What I do now is I go pee beforehand, and then throughout the drive to the doctor's office, I will sip water. So I had like a 32 or 40 ounce water bottle that I always have with me. And so I just sipped the water until I laid down at the table, and that was perfectly fine. So I wasn't like urging me to pee the whole time. It was like a comfortable full bladder. When you first get to the doctor's appointment, it's all based off of their timing. They told us to get there at a certain time, and I think that we sat in the waiting room for, I felt like it was a really long time, like at least 30 minutes. And once they're ready, we got up and followed them to the back room. So in the back room, do you remember when I talked about the stirrups on steroids? Your legs are like up to the nth degree, completely spread open, ready to go. Hello. Well, this is what they are. These are the stirrups on steroids that I was talking about. Like, you put your whole calf thigh in them, and it's very intense. So you'll get undressed from the waist down, and you'll lay on the table, and then eventually you'll put your legs in those stirrups. So your husband is supposed to be there with you at the appointment because they have you sign a consent form. And if your husband can't make it, then they'll figure out a way for him to sign it before you come, but that paper has to be signed before they do anything with the embryo transfer.
Hello, good morning.
Once a consent form is signed, you lay back on the table. They put a speculum in to open up everything so he can see your cervix. And then they take a swab of cleaner, basically, to clean off your cervix. When you get up after the embryo transfer, you're gonna leak some fluid out. Don't worry, because it's not the embryo, it's the cleaning fluid. Think of your uterus as like sticky peanut butter, and once the embryo like lays on the uterine lining, it sticks. Once the embryo's in there, it's in there. So you don't have to worry about it coming out at all. One suggestion the doctors give is to not wear perfume or cologne that day because the embryo doesn't like that. You can shower obviously beforehand, please shower beforehand, but I wouldn't wear perfume or cologne. Just a little side tip. When you're laying down on the bed before they put the embryo in and before they even bring the embryo to the doctor, my clinic had a screen, and on the screen they showed my name to make sure that it was me on the table, and then they zoomed up and showed the embryo.
Now watch the screen. You're going to see your name go by on the left, and then after your name goes by, you're going to see a little speck. You'll magnify the speck. That is the baby.
Once you confirm that that is your embryo and that is your name, then they take a pipette and they suction up the egg into this little pipette, and then they bring that to the doctor, and the doctor will then put the embryo into your uterus and then pull the catheter out. And before you get up from the table, they will check the catheter to make sure the embryo is no longer inside. And if the catheter comes out clean, that means that the embryo is safely in your body and you can get up and now pray for the next 2 weeks that you're pregnant. After the procedure, the doctors recommend not having sex for 12 days. At least that's what they told me and my husband.
Thank you.
You're in the bullpen. 12 days.
12 days.
Once we know you're pregnant, then we'll set up your ultrasound 2 weeks later.
Okay.
And we'll send you on to your OB doctor.
Okay. They just want to make sure that nothing is going on inside your uterus, so the embryo has an undisturbed environment to implant in your uterus and grow. So the embryo transfer, like him talking to us signing the paper, me laying down, was like 6 minutes. It takes like no time at all, doesn't hurt at all. Some clinics mandate that you take bed rest for a few days after an embryo transfer. My clinic didn't mandate that, but I did take it easy. My doctor doesn't recommend transferring 2 embryos. He only does 1 because there's a high chance that if you do have both implant, that one of the babies will have a learning processing issue in life. So I only transferred 1 embryo every time. And I'm glad I did, because now having my baby, I love having one-on-one time with her. And I think it would have been way more stressful if I had twins or multiples. But also, if I did have twins or multiples, it would just be super fun because they would have like a little playmate to grow up with. So there's pros and cons to each side, right? I only did 1 embryo transfer just because my doctor really recommended only doing 1. Your clinic will schedule a blood draw pregnancy test for you, and you'll go back in 12 days and get your blood drawn to see if you are pregnant. You can take pee-stick pregnancy tests, but the blood one is very, very accurate, and they'll tell you exactly, yes, if you're pregnant. Once you get a positive blood pregnancy test at a fertility clinic, they'll have you go in like the next day, take another one, and they'll have you go in a couple days later to take another one because they want the levels to rise at a certain amount. The blood pregnancy test confirmed that I was pregnant. So after you have a blood draw pregnancy test, they'll have you go in to confirm that you are pregnant with an ultrasound. The day before my ultrasound, I started bleeding. Like a couple drops, which I'm like, what? I was freaking out, okay? They brought me in a day early and they gave me an ultrasound a day early. And it totally worked. Like you can totally see the baby. Her little heart was flickering, which is awesome. So if you have an ultrasound that shows the beating heart, it's like a very unlikely chance that you'll miscarry at that point. You can still miscarry, but if they see a beating heart and they know that the embryo was a good embryo, you can pretty much celebrate because that baby's pretty much going to stay inside. If the embryo transfer fails, it's because nature was trying to help you out and be like, you don't want to mess with some issues that embryo has. The first 2 embryo transfers failed for me because I had something wrong with my uterus that they didn't know about. I had endometritis. I can talk about that later. When they did fail, my doctor, to reassure me, he said, it's nature's way of protecting you. Because if the embryo doesn't grow the way it's supposed to, it might have a lot of issues that you don't know about that will be very medically sad and financially hard to deal with. So if it doesn't work, it sucks, I know, but it might be for the best. It is normal to bleed a little bit in the early stages of pregnancy. It could be implantation bleeding. You can see in the ultrasound, you can see the egg sac, and then you can see this like gray crescent moon shape. That is the bleed, and they told me that that bleed will subside and everything looks good. And if you find out you are pregnant, the ultrasound afterwards, you might be able to see the baby's heartbeat or you might not. So don't freak out if you can't see the baby's heartbeat yet, because it just might not be grown enough to see it. The fact that you're pregnant and the fact that your blood levels rose the way they wanted them to is a really, really good sign. Once you have that positive ultrasound that the baby is in there, that is when they transfer you over to a regular OB-GYN and you no longer have to go to the fertility clinic. Once you go to the regular OB-GYN, they usually have you go in maybe 8 weeks, but usually around 10 weeks. 8 to 10 weeks is when you go in for your first appointment with them. The next video is going to be about the pea-stick pregnancy tests. So I bought 3 types of tests. I'm testing pregnancy sticks to see which one is best. We're going to do the Clear Blue digital test, the first response 6 days sooner, and then the dollar store pregnancy test. So we're just going to see which one works the best. And then I have a video talking about my pregnancy symptoms and pregnancy. And then I have a video coming up about the delivery. And I had a C-section, so we'll talk about that later on. They tell you just act as if you're pregnant because you most likely are. I use a donor egg and they told me it was 70 to 77% chance that it will attach and that I will get pregnant. So hopefully it's the same for you ladies if you have good quality embryos being transferred into your uterus. When you're going through infertility treatments, it's so hard to be excited because you know that it's probably going to fail because everything has failed before that, right? But this embryo transfer process, it's most likely going to work. So now let yourself get excited. Take it easy on like the working out and stuff like that until you find out that you're pregnant. So just let this be your princess 2 weeks because you deserve it. And I'm really, really, really excited for you guys. Let me know when your embryo transfers are and if it worked for you. And if it didn't work for you, talk to me because that happened to me a couple times. You can reach out to me on Facebook and on Instagram. I'm here for you and you're gonna love your babies. And I'm just so excited for you guys to experience what it feels like to be a mom. It is the best, loving, amazing love that you'll ever experience in your life. So I'm just really excited for you and just keep me updated. Thank you for watching Wanna Be Mama. Good luck, ladies.